Okay, so we've reviewed the anatomy of the extensor mechanism, and so now we're going to talk about the most common surgical procedures that we do for chronic mallet fingers when there's a persistent lag. The first is called the Fowler central slip tenotomy, and it's exactly that. It's where we divide the central slip where it attaches to the base of the middle phalanx. So if you look at the drawing over here, here's the drawing that we saw before of the anatomy of the extensor mechanism on the back of the finger. The central slip attaches to the base of the middle phalanx on the back of the finger, and the procedure is dividing the central slip, and when you do that, it retracts proximally a few millimeters. The whole tendon will slide proximally, and with that central slip and the extensor tendon, the lateral bands as well will retract proximally and pull on the terminal tendon, which now extends the distal phalanx. Remember, when the mallet finger heals, and if it develops a lag because the tendon pulls back, but it does fill in with a little bit of scar tissue there. So there usually is a little bit of attachment of the terminal tendon to the distal phalanx, even if a patient has a little of a lag. And we're relying on that when we divide the central slip to pull through the lateral bands and pull on the scar tissue on the back of that distal phalanx and now extend the finger. Now, one of the potential complications of this procedure is developing a slight lag at the PIP joint. So if you divide the central slip, will that finger lag a little bit? And in most cases it does not, but everyone's anatomy is a little bit different. So in some, if the lateral bands are stretched a little bit, it can lag a little, but in most cases it doesn't, and it's an effective treatment.